Hello, everybody. Welcome back to the studio for the Radiance chapter. Today, we have a very exciting guest again in the studio to talk about something very important regarding ourselves, our bodies, and our lives, and everything that we do because we have this body. And I'd like to welcome one of my girlfriends, Richa Rehan.
Thank you.
Welcome, Richa. Richa here. She is a pelvic health physiotherapist for 10 years and is local in our Ottawa area and works with multiple clients within the city of Nepean plus downtown, and has many friends that she works with around Ottawa as well. She is an entrepreneur and an author, as well as a mom to a 5-year-old.
Yes.
Very, very busy life. Yet she has taken the time to come out today and have a conversation with us. And we also have a blizzard outside. So go, Richa. That's awesome. You made it.
I made it. We had to do it.
You had to do it. I know. I'm very excited to have you here today. Okay. You have 10 years of experience of working with clients. And you took some of that experience, I'm assuming, and wrote a book, which is amazing. And your book is on Amazon right now, and anybody can go out and purchase it. We will link it. And it's called Things Every Girl Should Know About Her Body.
Yes.
So I have a couple things that I want to start off with. First, what made you come into this line of work?
So I started as a physiotherapist, and I was treating all kind of cool sports injuries. And suddenly there's this new field I was looking at, and it's called the pelvic health. Physios treating bladder leakage issues, painful intercourse. And I was like, I always love to explore, like, okay, what else is out there? So I was like, okay, let me look into it. What is it? What are they talking about? I didn't study a lot about it in the school. I didn't know the physio treating bladder leakage issues and pelvic pain issues, period pain issues. So I ended up signing up for the program from States. It was a 1-year program. And I was like, okay, let's explore. I did my course, I did my training. And after that, I started seeing women with bladder leakage issues, painful intercourse. And then I was like, okay, I love doing it, but I don't want it to take over my whole caseload. I love treating my sports injuries part. And then after 6 months, I realized that, yes, I'm treating ankle sprains, knee injuries, people getting better, but I have these female clients who are leaving from the clinic in tears that, oh, it's like I saw a 65-year-old woman who, like, that was the first time she had the pain-free sex in her life.
At 65.
At 65. And I was like, oh, it's like, this is life. Like, that was the first time I realized how important it is for somebody to have a good pelvic health and how life-changing it is for people.
Wow.
And slowly it took over 100% of my caseload. I kept getting more and more passionate about it, kept learning more and more about it. And like, I'm still learning. It's like, there's so much to know in this field.
That is astounding how many years women have just been suffering with these things. For pelvic health, can you quickly give us an idea of what area or where we're talking about?
Yes. So if I talk about it in very simple terms, anything related to pee, poop, and sexual health is pelvic health. Anything related to the bladder health, bowel health, periods, sexual activity, it all comes under the pelvic health. But when we look at the broader view, 80% of unresolved back pains and hip pain doesn't get resolved because there's a pelvic health component to it.
Seriously?
Yes.
So I've had back pain for years, especially after my babies.
Right? Exactly. So when you think that I'm trying to treat this back pain and why it's not getting better when I tried everything, mostly our pelvic floor is involved. That's why that back pain is not getting better even after trying everything, because we didn't even look into pelvic health. We didn't even see into it.
Wow. All right. I'm a little mind blown. That's it. That's amazing. So what is the connection between like the one that you're telling us that if you have back pain or some other pains that could be connected to your pelvic floor? How are they connected?
Yes. So what exactly is pelvic floor is? First, let's learn about that. The pelvic floor is the group of muscles. So anything from the pubic bone at the front to the tailbone in the back, all those muscles at the bottom of the bowl. So it's like everything in between those hip bones is the pelvic floor muscles. Now, as we see, the pelvic floor muscles, they don't work individually. So everything in between pubic bone to the tailbone is the pelvic floor, but at the front is our abdominal muscles. Those pelvic floor muscles go up to our tailbone, but there starts our lower back muscles. And on the top, we have a diaphragm, which is our breathing muscle.
Yes.
On the sides, we have our hip muscles, which kinds of overlap with the pelvic floor muscles.
Okay.
So we always think it might be a small muscle which we just hold and it stops our pee. It's a big group of muscle which is holding everything down there.
Yeah.
And these muscles work in coordination with the lower back muscles at the back, abdominals at the front, and hip muscles on the side.
Wow.
So when we talk about why back pain or hip pain not getting resolved if there's a pelvic floor issue, because the pelvic floor work in combination with the back and the hip muscles. And every time when we breathe in and when we breathe out, this whole core unit,
So like if I
moves.
do, this was via the muscles that also got used in my pelvic floor.
Yes. So, when we talk about the breathing, how like the lifestyle nowadays, we are busy. A lot of times during pregnancy or somebody with the chronic pain, when we breathe, we start doing more of this.
Yes.
What's the breathing we always talk about, like in yoga, in everyday life, or when somebody is like stressed, what do we say? Take a deep breathe.
Yeah.
What is the deep breathe? A full deep breathe is when we take a nice deep breathe, this doesn't move, our diaphragm moves down, the belly relaxes, the pelvic floor drops down. Think about it as a canister. When you breathe in, it moves down. When we breathe out, it comes back to the resting position. That deep breathing, when we talk about the core breathing, it's that lower belly pelvic floor breathing.
Wow. Okay. That's amazing. So basically, all the muscles that are in our pelvic floor are connected to the top muscles, the ones that we can feel and touch, but they are deeper on the inside, but they are all connected and they work together. So if one is weaker,
other will overwork to support it. You know how we say our body compensates?
yes.
So if we have a weak core, how we always talk about the core muscles, have a stronger core. Everybody working in the gym to get a stronger core. Pelvic floor is the foundation of our core muscles.
Wow. It's like, when they say in Pilates, like they say zip it up, like zip. So it's your pelvic muscles, and zip the muscles up. That's what they mean.
So when we talk about the zipping, it's like zip all the way from anus to the vaginal area to the lower belly. That's what the zipping means, not just this.
Oh, wow. How do you zip that? What? That's craziness. Have a sip. Okay, so zipping it up all the way from back there to the front. And basically that allows the pelvic muscles as well as the adjacent muscles and the back muscles to get stronger.
That's right.
And that's the whole entirety of the core.
Yes.
Very interesting. You touched on 3 different aspects of this. You touched on bladder.
Yes.
You touched on sexual health. And you touched on, you said poop is also part of it, right? So anal health, bowel health is all part of it. So can you touch upon these a little bit and explain them?
Yes. So when I talk about the bladder health, what do you think, like the normal peeing frequency? Like normally how many times do people should go for pee in a day?
Well, I don't know, man. I drink water and I'm peeing all day. Is that supposed to change?
So no matter how much you're drinking, normal peeing, like how much water by that, I mean, if you're drinking a good 3 to 4 liters, 2.5 to 3 liters.
Yeah.
Normal peeing frequency is 5 to 7 times in a day.
Is that it? It feels like I'm always in the bathroom.
A lot of moms complain about that.
Yeah, okay. Let's get to that one.
So normal peeing frequency is 5 to 7 times in a day.
Okay.
0 to 1 at night. And you know how a lot of people says like, I have a small bladder? Having a small bladder is a very, very, very rare thing. Most of the people don't have a small bladder. It's the bladder habits.
Okay. We have small bladder habits. Okay.
Yeah. No. What happens is, so for example, this is a bladder.
Okay.
When it starts filling in, our brain gets a signal that bladder is filling. When it gets more full, brain gets a signal, bladder is full, I need to go and pee. Mm-hmm. When it gets really full, it's like, oh my God, I need to be in the washroom right now.
Yeah.
If we keep emptying that bladder at lower level, our brain starts thinking that that's the actual capacity of the bladder. And it starts giving you signal more frequently. That's where people start complaining about frequent urination. And that's when they have to, like, okay, I have to go pee every hour or every half hour. So it's the habit. Our brain needs to know what's the actual capacity of the bladder. Only go for peeing when you really have to go. Other opposite of it, we call it just in case peeing. No just in case peeing other than you're going to bed or if you're going out for a few hours.
Okay, so I do my just in case peeing if I'm traveling an amount of distance. For example, if I'm going from here to Toronto,
yeah,
even Montreal. So that's leading up question. We're training our brain to understand what the actual or the optimal level of a full bladder is before you have to go pee. That generally should happen between 5 to 7 times in a day.
Yes.
Now, the opposite of that is when you have to pee and your brain's giving you that signal, but you're holding it.
Yes.
And you're not going to pee.
Yes.
Is that a good or a bad thing?
That's bad thing. So as like your body should normally be able to hold like, so how we say like 5 to 7 times in a day, we can also say every 2 to 4 hours. So you're not supposed to hold more than 4 hours because then it's almost like it's expanding, you're ignoring those signals and your body is asking you to go and pee. So that's bad too. Mm-hmm. Because then your muscles are all clenched up, trying to hold that sphincter and trying to all clenching up, and that's not good. Mm-hmm. So when you need to go, we see a lot of patients who are nurses and teachers.
Yes.
Because they hold for too long.
So does that make the pelvic floor weaker?
Yes.
Although you're tightening your muscle, aren't you supposed to tighten your muscle to make it stronger?
Yes. So, for example, imagine you're doing a biceps curl.
Okay.
But you're doing that biceps curl for 4 hours.
Not a very strong bicep, I would think.
Yes. It will, rather than that, you will have a sore arm because your muscle is over clenched and been tight for too long. So it needs to be relaxed.
Okay, got it. Okay, that was a great analogy. I understand. Very cool. Yes. I had a leading up question to that as well. So when we are holding on, there is another additional thing that happens, and I don't know if it's a physiological phenomenon. I think you get gas made in your system because you get bloated when you're holding on to your pee. Is that something that the bladder does, you think? Is there a connection?
I think the bloating have more connection with the digestive issues.
So if you haven't peed, because peeing out is toxins, pretty much.
Yes.
What you're doing is letting the toxins out.
That's
because
right.
You're holding it in, it's staying inside of your body. And so that might be the reason why.
Exactly.
It's fermenting and creating
and
gases.
like a lot of people, they feel like, okay, like, so a lot of moms who have the bladder leakage issues or a lot of women who have bladder leakage issues, like getting into perimenopause, menopause sometimes, they will be like, oh, I'm going to keep emptying my bladder so that I don't have any pee in there and I will not leak. But it doesn't work like that because you always have some residual pee in the bladder. So even if you keep emptying it, if you have the bladder leakage issues, emptying it is not going to help.
Let's talk about that. You said perimenopause and menopause.
Yes.
Okay, which is great because I'm in that age group. And we have women and friends who talk about it can't laugh too strongly, sometimes can't cough, can't sneeze. and then sometimes you get a bladder leakage.
Yeah.
So why does that happen at that particular time or age of like 35, 45 onwards? Is there a connection there?
Yes. So as we get into perimenopause, estrogen level starts dropping down in the body. Our vaginal tissues, the pelvic floor muscles, they feed off estrogen. When estrogen starts dropping down, the strength of muscle, you know how it affects the bone health, heart health, pelvic health. Yes, so those muscles starts getting weak. So those muscles need more work. You need to see a pelvic physio. You also need to be on vaginal estrogen.
Oh, do you prescribe that?
We don't.
Yeah.
So in
That's physio, you could suggest it.
Yes. So usually what we do is when we are seeing somebody in that age group, we will write a letter for our doctor that can you please prescribe the vaginal estrogen if it's a good choice. Then if they agree, they will. In US, they are available over the counters. We have here only over the prescription.
Really?
Yes.
So you mean estradiol, like vaginal estradiol, is available in the US over the counter?
Because the vaginal estrogen is it's a micro dose of estrogen. It doesn't get absorbed a lot in the system. It's very, very localized. So it's a very safe option for most of the people.
And did that change the strength of the muscles then eventually? Or do you still have to train them?
You still need to train them, but it's easier to train them when the tissue is healthy. So it's like if I have healthy muscles, it will be easier for me to train that muscle.
Yes.
But if the muscle is fragile, if the tissue around it is fragile, it will be harder to train it.
Very interesting. And do you come across situations where somebody is on HRT and is still having an issue? Or,
yes, because even if so for example, you have estrogen, you are on HRT, so your tissues are fine.
Yeah.
But your muscles are either too weak or your muscles are too tight.
Okay. All right. So when you get a client that's like that, for example, what is your prescribed, like how do you treat that client?
Yes. So it can, like the bladder leakage is a symptom which can go either way. It could be weak muscles. It could be also tight muscles.
Oh.
Yes. We'll talk more about it. So when we do the internal exam, by internal exam, I mean vaginal exam. So, the vagina is almost like a tube, but the pelvic floor muscles are very external. The pelvic floor muscles is almost in that first 1/3 part of the area.
Okay.
So it's not like a speculum exam. I know a lot of people are like scared of like, oh, I don't want to go for the speculum exam. It's going to be painful or uncomfortable. But the pelvic exam from the physio is not a speculum exam because the muscles are so external. So when we check the pelvic floor muscles, we know if the muscles are weak or muscles are too tight and they're not relaxing. So any tight muscle is also a weak muscle. So it doesn't matter if the muscle is tight or a weak, it's going to be a weak muscle. So I will again give the example of my biceps. If I have a tight biceps, it's not a functional muscle, it's just tight. It doesn't mean it's a strong. I can't pick up a coffee mug and bring it here because it's so tight, it's just holding it here.
Interesting.
So you need a strong muscle, but you also need a nice and relaxed muscle.
So it works in both ways.
Yes. So any muscle to have an optimal function, it needs to be strong and relaxed.
Very, very cool. You said speculum. Okay. Now it's a term. Do you want to explain that really quick?
Yes. So the speculum it's a device to check the cervix, and so example for when we are doing the pessary fitting or when we are checking the vaginal tissues. So it's almost like anybody who have the pap test, they know it's like it's put in, open to check the cervix, to check the vaginal tissues, how the tissue, not the strength, but how the tissue viability is, if tissue is healthy or not.
It has to be looked at.
Yes.
So here we're not really looking, we're feeling?
Yes.
That's the difference.
Because any muscle, when we are checking the pelvic floor muscles, when we check that, the way muscles are squeezing and the way they are relaxing, we know if the muscle have a good strength and good relaxation or not. And then based upon that, then we decide an exercise plan. A lot of women who have the pelvic floor issues, we also have to check their abdominal. Because a lot of us, we hold a lot of tension in those lower abdominal muscles. Like we call it a mommy pooch, where people complain about, I'm not losing this because it's not moving enough with the pelvic floor. Most of the people have a weak pelvic floor. That's why they have that tissue, because that's why the muscles are not able to strengthen.
Leading up question to that.
Yes.
Okay, when you say mommy pooch, we women have natural births and then we have cesarean sections. Okay, is there a difference in the two when you're looking at abdominal health?
Yes. So with the terminology, we
Yes.
have vaginal birth and we have C-section birth.
Vaginal birth, not natural, vaginal. Thank you.
So yes, sorry, go ahead. If that changes
So
the one.
does that make a difference in the way
Yes.
that, okay, and
So what happens is with the C-section, so I get a lot of patients where there's like, oh, I had a C-section, my pelvic floor should be perfect because I didn't give birth vaginally. Most of the time, the tension on the pelvic floor comes with the 9 month of pregnancy, less with the mode of birth.
so it doesn't matter that the baby has to come through the canal and move everything around and then pushed out and all of that stuff. It doesn't really.
It doesn't
Really?
Vaginal birth have more chances of pelvic floor dysfunction, but both have pelvic floor dysfunction. So, and talking about mommy pooch too, C-section have more common chances of having mommy pooch. The reason is that when the C-section happens, there's these 7 layers cut into, and those 7 layers, they create a scar tissue and adhere together. Now, when there's a scar tissue, how we talked about our abdominals, pelvic floor, they all need to move in the coordination.
Yes.
When there's a scar tissue up there and that scar tissue has not been worked on, it's all tensed up there and the pelvic floor is not moving the way it's supposed to.
Okay.
We see more complaints of pain with intercourse after C-section as compared to vaginal birth, because all the scar tissue in that abdominal area is not letting the pelvic floor relax. And for any sexual penetration, the pelvic floor needs to relax.
Yes, so that it's not painful. That's interesting. So the scar tissue is what's in the way.
Yes.
And so when you say work the scar tissue,
Yes.
what does that mean?
So when somebody have a C-section and they have the incision and scar tissue in there, that scar tissue needs to be worked on. So you know how somebody have a knee surgery, a shoulder surgery?
Yeah.
When they leave the hospital, they're always told, like, work on your scar tissue, massage your scar tissue.
Okay.
Most of the women I see after the C-section, they are never told to work on their scar tissue, massage their scar tissue. Most of the time, it's just left alone. I see so many women, they never touch their incision and they hate to touch it. Imagine.
Because it feels alien. I've got that.
Yes. So the more we touch that area, the more we massage it, you know how the brain and body connection, that the more we touch it, we move it, our brain gets connected to that area, connected to those muscles. It's easier to expand, it's easier to squeeze, and that's how we build up the strength better.
Okay, I have C-section. Both my children were C-section, and I was not instructed to take care of my scar and or work it, or
Yes.
what you want to say, was not part of it. And let's just say in my defense, okay, you've been working in this field for 10 years, and in the defense of the doctors and myself, I've had my first child who's going to be 18 this year. So maybe that many years ago, they weren't really that cognizant of the fact that needs to happen. And
100% of the C-section women I see in today's date, nobody is told to work on their C-section scar.
even today.
Even today.
Well, that's not good. That's not good. So when you're working with women that have the scar, and they have not been told to take care of it, and I understand when you say that there isn't a connection, because it feels it. I remember feeling like I was touching rubber.
Yeah.
Or something that was outside of my body, something which is not part of my body. So when I would touch it, I'd be like, I don't know, this feels weird.
Yeah.
It's like, you know, when your foot falls asleep or something, and then you have to like you cannot feel it, and if you touch it, it doesn't feel like you're touching your own body part.
It feels weird.
It feels weird. So I did feel it, and the fact that you said that sexual health also depends on that, and painful sex is one of the reasons why you have that post babies and post C-sections, is that scar, that
Yes.
scar tissue. I do have experience with that. Not anymore, but I do have the experience with that. So how do you get to that place where you're taking away the pain for women?
So what we do is we first examine the incision. We usually, when we are seeing them, like now the good thing is like we are seeing a lot of women during their pregnancy. And they will come in, they will come for the birthing education, they will come for the labor education.
Well, that's nice. That's new.
Yes.
I wasn't referred to anybody.
And we promote it, and it's like, yeah, we do offer like 2-hour workshop, everything related to labor and delivery.
That's wonderful.
Yes. And we talk about all of this. So then they know after having a C-section. So no matter somebody have a vaginal birth or a C-section, we book them a 6-week postpartum checkup.
Okay.
And then we check their incision. We teach them how to do a scar tissue massage. That do it every day. This is how you start. This is how you progress. And do it every day at home. And then we see them consistently until there is no issues with anything related to bladder, bowel, and sexual health. We help them to build up their core muscles so that they can, like, women are not sitting at home nowadays and not doing anything. They want to get back to the gym. They want to get back to the soccer. They want to get back to the running.
Yes.
They want to do everything. They want to go to the trampoline park.
Yeah.
Without the leakage.
That's right.
So, yeah.
That's true. That's wonderful, and that's a lot of insight and a lot of help at that point of time in your life when things have really changed, like you really have. And I mean, growing a whole person inside of your body, it's already pretty alien, and then, and then having to push the baby out or cut the baby out, which is even more.
Yeah, it's a major surgery.
But it's not considered a major surgery.
Yeah,
I understand that. But it is. And all the muscles and the 7 layers of skin and muscle and tissue that gets cut out and whatnot. But like, these are things that do happen because, I mean, okay, so you're at that age in life and you have babies and whatnot. But I want to understand, as per your expertise and your experience in this, how early or how soon should pelvic health be a conversation?
Oh my God. Okay, that's a great question. So that's where the idea of book came from.
So, your book.
Yes.
Okay.
All these women, when I'm seeing them, so I'm seeing right now anybody in age of, like, I see women with pelvic pain or period pain in that 24, 25. Like, imagine at what age do we get the periods? I'm seeing them at 24, 25, and it's like, I have a pelvic pain or a painful intercourse, and I need help. Then I start going into their period history. I was like, okay, how about your period cramps? And it's like, oh yeah, I always had bad period cramps. I will faint in the school. I have to miss the work. Isn't it normal? And I was like, no. No amount of period pain is normal where you have to miss work or miss school. So then I started going back. It's like, okay, where are we lacking the information? Like, why I'm seeing them at the 24 age when they get their period at 13, when they're fainting in school because of their period pain. I was like, oh, it's like you never see doctor for that, or you never looked into it. It's like, I did. I was told that it's a period pain. It's normal to have.
Normal.
A mild cramping is okay, but period pain is not okay.
So it's not normal that I've had so much pain that I've had to get into a ball, get myself a hot water bottle, pop in Advil to deal with my periods.
No, it's not normal to have that. When that much of period pain is there is something else going on which needs to be checked. And it could be endometriosis, it could be PCOS. There are so many different women's health conditions which could be related to it. And then I asked them, I was like, okay, so how was it with the tampon? Were you able to use the tampon? It's like, oh, I could never use tampon because it hurts. So when at the age of 13, 14, the first time when it was hurting with the tampon, you know in the future it's gonna hurt with the penetrative sex.
Oh.
Because if you're not able to insert the tampon, how a penis will go in if you're trying to have a penetrative sex? So when I'm seeing them at the age of 24, 25, I started circling back. I was like, okay, where are we lacking this education? It's the sex education. We teach kids how not to have babies, but we don't tell them enough about their body parts, that this is vulva, this is vagina. It's okay to talk about these body parts. We teach them how to say a shoulder, that a shoulder is a shoulder. Then why do we have to have the names for the vulvar area or the vagina? We need to teach them the right name so that when there's a problem, they can tell where the problem is. Coming back to your question, at what age kids should know about the pelvic health? When we start teaching them the name of the body parts, they need to know the name of the right body parts. So a 2 or 3 year old was like, okay, this is the vulva, this is anus. Like, it's good for them to know that this is what it's called. And when they know the right name, there's less shame attached to it. They don't feel like, oh, it's like we're not supposed to talk about it. Because if we are not using the right name, it's almost we are telling them that you're not supposed to say it.
I love that you brought this up. Okay, this is amazing. Taboo. We don't talk about sex. We don't talk about body parts, female body parts.
Yeah.
We don't talk about female body parts at all, ever. We also, men have that too.
Yeah.
Boys are also taught not to be able to say body parts, their own or female body parts, because it's just considered bad. Like, it's just so bad to talk about these things. But then this can play a role in your health in the future. Do you think shame is also part of an unhealthy pelvic sort of an area?
It is, because like the more like when we're not talking about it, there's so much shame attached to it. Like anything we don't talk about, there's something wrong with that. It's bad. That's why we are not talking about it. So we are almost kind of putting that idea in their mind that don't talk about it. So then when there is a problem, when they start getting the period cramps, or when they're not able to use tampon, they was like, oh, it's like, I don't want to talk about it. When I launched my book, there was a mom, and she was a South Asian mom who have a 10-year-old daughter, and she reached out and she was like, okay, I want my daughter to know everything about the period products, about the periods. Can you talk to her? And I was like, sure. It's like, what do you want me to tell her? And she was like, just explain her how period works and how the period products work. And I was like, sure, you come with her and I will explain her. I talked to her about everything, and I was like, do you have any questions? And she was like, if I use tampon, what if I lose it in there?
That's a valid question, okay? What if you lose it in there?
And I was like, it's a vaginal canal. It's not like a deep, it's not like a dark hole.
It's gonna come out of my mouth.
So it's like, you're not gonna lose it in there.
But there are occasions when it gets we've heard of this, medical emergencies, or sometimes women will have a tampon inserted, and then when pulling it out, the whole thing doesn't come out, and then some of it gets stuck inside, and then it starts to
like the toxic syndrome, what we call it.
Yes.
So it's like when you're using the tampons, no matter you're using the tampons, pads, anything, always read the packaging. It says for how long you can leave it in there. Usually for the tampons, we always say don't leave it more than 4 to 6 hours, like change it in that time.
Well, you know how expensive these period products are? Yeah, well.
And we have better products nowadays. We are living in the like a good technology era. We have menstrual cups, we have this, we
menstrual
have
cups,
panties.
Let's talk about a couple. Do you have any experience of menstrual cups with your clients?
Yes.
Do you suggest those over anything else?
It's, period products is something like how there are things where we have personal preference. I would say when you have young daughters, lay them all out that you have this wide variety of products. And see what you like. Education. Might be they like menstrual cups over tampons, or might be they like tampon over menstrual cup because it gives them more comfort. But I would say 99% of my clients who use menstrual cups, they love it.
Really, eh? Huh.
And they don't want to go back to anything else.
Would you teach somebody how to use them?
Yes.
Okay. That's the most important thing.
Yes, because I also have heard complaint from a lot of people that, oh, I tried the cup, but it was leaking. So it leaks when it's not fitting properly or when it's not the right size of the cup. It takes few tries for you to find the right fit for you. But once you know, like if it's not fitting well, then there is a reason behind it why it's not.
Interesting. And do you think that's because of tight muscles or loose muscles or?
So anybody with the tight pelvic floor will have hard time using the tampon, hard time using the menstrual cups, because those muscles need to relax for anything to go in.
But a lot of the times the tightness has to do with anxiety or fear or shame.
Yes.
And especially for women, because first of all, you can't even take the name of the body part, let alone touch the body part, let alone try and take care of your body parts.
Exactly.
And it just accumulates over a period of time. And I feel that we don't really educate our girls enough. I don't feel we empower our girls enough to feel comfortable about all of these things. And eventually life for women is all about pelvic health, I believe, because, starting from periods to sex to babies down to perimenopause, the uterus changing, the drying up of it all into menopause, all of it is pelvic.
It is, like, we laugh about it. We say, like, the whole health is a whole health.
I love that.
So, like, yes, like, education is empowering. Education is, like, it makes girls stronger. If they know more about it, they are able to do better for themselves.
Is that one of the reasons why you wrote your book?
Yes.
Was it because you're a little girl?
Yes. So my daughter is 5 and she knows a lot about pelvic health because she hear me talking about it over the internet. She have been in many workshops with me because if in case my husband is away, I will just bring her with me. And she's very comfortable. So I was like, okay, that's the age group we want to empower. That's the age group we want them to have knowledge about it, so that there's no shame attached to it. It's a normal body part, like how it's, like we call mouth a mouth, we call shoulder a shoulder, we call vulva a vulva.
Have you come across clientele or women that actually can't name the body parts?
Oh yes, a lot of times.
Can I tell you that I recently learned, like, I'm not recently, like now, but like recently, the past couple years, I think nearing my 40 is when I learned about the different, and I was like, oh, what? How do I not, maybe I didn't pay attention in school, I don't know, but how do you not know this? Like, I should know about my own body.
But like that's the thing, is like we are not the only one. It's like that's how it's like from the younger age. Like now we are still doing better, but even like today in the school they don't cover it all. Like
No.
These are the body parts, this like the hygiene part of it, like everything is related. If we know the body parts better, we are able, like I feel like half of the industries are feeding off the fear mongering in women. Like, the scented products, the scented vaginal products, the scented pads for teens. Like, why do teens need scented pads? Anything scented in the vulvar area will cause irritation.
Because it's toxic.
Yeah.
It's perfume.
And by telling them that, we are telling the teens and the tweens that, oh, it's supposed to smell like flowers down there. Like, no, it's not. It have an odor which is normal.
It's supposed to look like a flower down there. I don't know if it's supposed to smell like a flower down there. Really, you're so right. And it's a perspective that I didn't think of, but you're right.
It's all fears, like, oh, it's like, what if I don't I see a young girl and she is in her 20s and we had so many conversations about she's like, what do you think about a surgery? She feels she have a body dysmorphia and she feels she don't look normal down there. and I was like, she is not ready to use a mirror and look. And I tell all my patients, it's like, look at your vulva. You need to know what's normal. You need to know how it looks. So it's like, it's interesting. Do we ever say that I want my body back, which was pre-puberty? No. Nobody say that.
Like a child's body?
Right?
No.
But we will hear so many women in their 50s like, oh, it's like I want my, or like lot of postpartum moms,
body back.
I want my 20s body back. Why? It's like, it's a change. We should be able to taught to accept those changes, able to feel good about those changes, that it's a body and it will change at every phase of our life. And it should be more acceptable and more good about it.
That's deep. That's very deep. But you know, we have these standards, the beauty standards,
Yeah.
the standards of how we're supposed to look and be and, you know, come across as women. And accepting all of that means unaccepting everything else.
It is. And like, it is so new that now I'm getting more illustrations of different colors of body, different types of body in like 2024, 2025.
Because otherwise it just was the one standard.
Yeah.
Just like what some guy believes some woman's parts.
This is how it's supposed to look like.
Like the Barbie doll idea.
Yeah. And most of the girls, they grew up with that idea that my vulvar area is supposed to look like all pink and white and stuff. No, it's an area where there's a friction. There is like, no, it darkens. It's normal to have dark area.
It's like underarms.
Yeah.
They get dark.
Exactly.
Yeah, all the joints, all the areas like knuckles, like they get a little dark. It's just...
It's normal. It's that's what the normal body looks like.
I guess not for the like really white girls. It looks very different, but like that cannot be the standard. That's not what I look like.
And that's not the young girls want to see growing up. It's like, okay, there are different colors of body. There's different type of body. How no two thumbprints look same, that's how no two vaginas look same.
That's like therapy. Is that part of what you do as well? You have to like kind of...
That definitely, like a lot of like, we keep our appointments longer. We don't do a regular 20-minute physiotherapy follow-ups because we can't, because a lot of time, half of our appointment goes in the conversation. And that's how like my practice changed, because so many people will come and like, I feel already so, like I saw somebody, she is like 28 weeks pregnant. I saw her during her first pregnancy and postpartum, and this is her second pregnancy. And I saw her today, and when she was leaving, she's like, I already feel better. I was like, thank you. I was like, that validates that why I do what I do.
Because what you do is you're just not checking for pelvic strength. You also are creating female strength. You're allowing the women to come into their own, to understand that their power lies within themselves.
Yes.
And how they look at themselves. That's incredible work.
So you know how you talked about the stress?
Yes.
Does the stress affect the pelvic health?
Because we're told as women, we actually hold all of our stresses and all of our anxieties in our pelvic area.
Yes.
So the front and the back, in our hips as well. So when we do yoga and they tell you to relax and like let the legs get a little wider and stretch them a little longer, I have come to tears every now and then from that activity. And then right after that, felt like some weight got lifted off of me, but not my shoulders.
Yes. So you know what interesting? Okay, so when we are stressed, what do? Clench, right? Do one thing for me.
Oh, okay.
Keep your fingers on your jaw.
Okay.
Clench. Relax. Now clench it hard again and bring your attention to your pelvic floor. What did your pelvic floor do?
It's tight.
Yeah. So when the embryo is formed, there is a fascial connection from the pelvic floor to the jaw. You know, when we talk about our body is all connected, it's one unit. So anybody with the stress, with the chronic pain, that's why they have pelvic floor issues, because it's all clenching. So when we clench,
Automatically did.
it automatically clench.
I tried not to, but
Yes.
it didn't work.
Yes. Now one more trick.
Okay.
Do this. Press it hard. What did your pelvic floor do? It just relaxes.
Yeah. It was like, hello. Let the air come in.
Yeah. Let the things move.
Yeah. What? Okay, so what was the difference here now?
So now it's almost like so it's a technique we use when people have a higher, like a central nervous system really hyped up. So anybody with like a major stress or a lot of pain, a chronic pain, the nervous system is up here, right?
Yes.
So we just like break that tension, and when we do this, it let the muscles relax, let the tension go off.
Wow.
So when we are teaching somebody to relax their pelvic floor, we use a lot of these small tricks, and it's like, okay, do this every day to let your pelvic floor relax. So when we talk about the breathing, it's easier to say, it's like, okay, do a deep breathe and breathe into your pelvic floor.
Yeah.
And I will have a lot of women, it's like, I'm trying, it's like everything moving up here, but nothing is moving down there.
Yeah.
But it's all that chronic stress. It's just everything is so clenched. So I tell them, like, when I see somebody with the pain, or when I see like busy moms, I'm like, throughout the day, few times, just do a scan. Unclench your jaw, drop your shoulders down, breathe into your belly, unclench your bum.
Oh, okay. That's a thing. Do you know?
It is a thing. A pancake butt or a mom butt.
Yeah.
Yeah. So pancake,
Like-
like a mom butt is a pelvic floor issue.
It's called a mom butt.
Yeah. It's also called a pancake butt. I don't know which one is better. So a lot of moms,
okay.
they come in and they say, I lost my butt after giving birth.
And that's because of stress?
So that's because of the weak core muscles. When we have weak core, we clench our glutes to support that core. And that's over clenching. We constantly keep our butt muscles clenched so that it can support the core muscles. So that's why that flattening of the butt appearance happens in the moms. So if we work on our core muscles, we will get our glutes back.
Really?
Yes.
So any amount of those donkey kicks and,
Yeah.
the going down and everything with the weights and doing all the squats and everything.
But it's already clenched up. So first you need to relax it and then work on it so that it can get into a better shape.
Wow. This is... Well, I don't have a pancake butt. Also because my kids are much older now.
Yeah.
But I'm
You
sure.
worked on it.
Okay. I did. Wow, that's amazing. That is just literally fantastic. Rita, I think this has been such a great, this is so, and I think there is so much more that we can talk about.
Yes.
I'm sure you have a list of things, but keeping our focus on this conversation today. Also, I am very excited that you are going to be one of our panelists for the female effect. And that, then you can definitely bring us, would you bring us like actual things to see? Would you be able to bring us some...
Yes, so
tools?
I'm so excited about it because I'm way more passionate about talking about these topics, and I always make fun of it. It's like, yeah, if you have any problems related to pee, poop, or sex in your life, I can help you with that. So I'm going to bring the pelvis so that actually people can see. It's like, okay, what muscles are we talking about? I will bring the vulvar model, so it's like, okay, how it looks like, where exactly when you're using the tampon or a menstrual cup, it's like how to use it, how to fit it in.
That's amazing.
If there is any problems related to the back pain, hip pain after giving birth, period cramping, we can talk about it all.
This is so exciting. Stuff that nobody ever talks about.
Yes.
Conversations that we cannot have. The only conversation that I hear, especially now that I'm in that age group of women that have that bladder leakage thing, is the bladder leakage thing.
Yeah.
But previous to this, there's never had any of these. The only like, oh, I can't laugh too hard, or I coughed, and like that kind of stuff. And it's like fear. It's like, oh my God, like I can't.
And it's so easy to resolve it. Like like I have such a good team of physios, and when I start training them, I always say the bladder leakage issues are the easiest things to treat for us. Like it resolves so quickly, it resolves so easily.
It's like knee sprains. No, knee sprains are harder.
No, knee sprains are tough. Bladder leakage are easier. Oh my god!
Really?
Yes,
oh my
yes.
goodness.
Way simpler than that.
You know what? These are not things that we know. So
Yeah.
I am so happy that you could come here, and I'm gonna look forward to seeing your book. I was hoping that you'd have it today, but you forgot it. So.
But I'm gonna bring some copies at the event.
Oh, that would be
Yes.
wonderful. That would be wonderful. Richa, thank you. It's been you saw me. I was like, what? So these moments is what I live for. I love it. Love it. And taking out the time and being able to come and do this with us and talk about all of the stuff that nobody ever wants to talk about is commendable. Thank you. Appreciate it.
Thank you so much for having me. And we need, like, there is so much more. Like, we can talk for hours about
I know
it.
we
There's
can.
like so much left.
I know, except we're looking at
Yeah,
freezing rain right now, so I'm a
exactly.
little cognizant of that.
Yes,
But
so we will
shall
do
have you
that.
back, and we can talk about more things.
Constipation, periods, everything.
I was going to bring up constipation, but I thought I'll hold that topic off for because it's going to be a longer conversation.
Yes.
I feel so, but I think there is a lot more in terms of sex education. In terms of, I love the idea of educating around period products
Yes.
and the usage of them and the multiple variations of what they are, and because it's a personal preference thing.
Yes.
But nobody actually knows what to do with them, which is the sad part. And then also starting the education young, because why not?
Yeah.
You were born with all of this stuff. You should know about it, right? And I think that is commendable. I appreciate your time, and I appreciate the knowledge that you have shared, and I look forward to talking to you more.
Same, and thank you so much for creating this space where we can have all these conversations. It's so important.
Correct.
My socks are not coming in the...
No.
Right, okay. Just to make sure.
They're nice socks.
No, but I would have done better otherwise.
You would have worn pink socks?
It's not coming in the picture, so we are good.
I mean, I can grab you pink socks if you want.